Welcome. My name is Chris Hill. I'm the board chair and CEO of CindXR. This is our Wellness Journey interview series, where today we'll be joined by Dr. Charles Cavo. Dr. Cavo is a co-founder and chief medical officer of Pounds Transformation, and we're lucky enough to have Dr. Cavo as an advisor, board advisor to CindXR. Welcome, Charlie.
Thanks a lot.
In today's edition of our Wellness Journey interview series, we're going to focus on the trends as we see coming into the new year. Trends that range from personalization of health to include advanced technologies such as artificial intelligence through group-based therapy and other web-based tools. Really came up with 5 trends that we want to focus on for this edition of the Wellness Journey. The first is really personalized medicine, and in particular, personalized nutrition. Charlie, can you talk a little bit about that and a little bit about where this personalization is going as we look towards the new year?
Yeah, sure. Thanks. So personalized nutrition is, I think, pretty important for people to understand the relevance. In our practice, a lot of times will hear people coming in as new patients and looking for what the best diet is. And there's so much information out on the internet about this is the best diet or that's the best diet. And honestly, people should start to recognize that the best diet is really going to be an N1, like what is right for that person. And you can really boil that down to understanding what their lifestyle is like and what their biomarkers look like. So getting blood work, getting body composition testing done, and understanding lifestyle to really personalize not necessarily a diet, but nutritional changes that a person could make to really see some remedies for chronic conditions that they may have or prevent chronic conditions that they don't want.
Or how do these diets relate to the personalization techniques you have for the individual?
The diets that are out there, they can be a nice launching pad for a person to lean into with regards to some guidance, but as far as really boiling it down for what the person is going to be capable of doing, I think that's more important. So most of the patients that we see, we will be doing something with their macronutrients. So we will be doing something with their proteins, their carbohydrates, and their fats, and working to better balance those macronutrients to support whatever medical problems they have. By far and away, most people need to have some sort of carbohydrate reduction when we approach how we're going to help them from nutritional standpoints. And we also recognize that most people really need to increase the amount of protein that they're eating for sustaining things like skeletal muscle mass. Most of us are not eating enough protein, and most of us are overeating carbohydrates. A lot of times, like what I find is patients, when you make that change, patients start using a misnomer and are saying that they're on a high protein, low carbohydrate diet, which also is a sort of, I guess, guide that people could sort of think of, but that's not even close to being accurate when you increase somebody's protein and you're doing it at the recommendations based on body composition and lean body mass. You're not necessarily moving a person into a high protein diet. You're moving them into a place where they're having adequate protein for their body composition. And when it comes to carbohydrates and how many carbohydrates is appropriate for a person to have, you can really look at a person's blood work to get a sense as to where they are with their carbohydrate consumption and their glucose metabolism and where you need to get them to. Most people come in, they're pre-diabetic or they already have high levels of insulin. And for that reason, we will find out how many grams of carbohydrates they're having in the course of a day. Average American diet's around 150, and we will be bringing those people down. So I think that's important, whether you're talking a ketogenic diet, Mediterranean diet, a vegetarian diet, carnivore diet, any diet will really work because you're changing already the landscape of what a person's eating. You're changing the macronutrients, and you're most likely changing the calories also. So I think when people are thinking about nutritional therapy or nutritional changes, not only do they have to take into account their macronutrients and getting the protein, carbohydrates, and fats balanced so their appetite's controlled, But then once that happens, we do need to take into account what their caloric consumption is. So calories do matter also. So there's kind of a paradigm that you have to think of when you're approaching changes in your nutrition. One, how much protein do you need? How much carbohydrate do you need? How much fat do you need in order to have your appetite controlled? And then once you're there, if you're seeing changes on the scale or in your body composition, great. If you're not, I think it makes sense to look at the energy amount of calories you're consuming and maybe start to look as to whether or not you need to dial down your calories. And we would always start with calorie reduction, looking at the carbohydrates and fats first and second, trying to spare the proteins from being carved out because, again, most people really are deficient in protein and quality protein. So we try to keep those in play.
Understood. Let's go to the second trend. I think one of the big headlines, in fact, across any industry, any topic, be it politics or sports or what have you, if we were looking at for the past year, one of the headlines, one of the developments, if you will, the treatments around GLP-1 surely would be one of those topics. But I also know that there is a lot of natural treatments around insulin resistance and metabolic dysfunction that it also now becoming a play, even beyond the pharmaceuticals, different types of sugars, different type of ways of dealing with GLP-1. Could you talk a little bit about that development? It certainly did it seems like took the market by storm. And where is that heading towards in the coming year?
So yeah, the medicines have been very useful actually when you're looking at managing obesity for patients that have been, doing everything under the sun and still not seeing any changes in the scale and body composition. The medications that I think we're talking about are the GLP and the GIP drugs that are out there: Wegovy, Ozempic, there's Zepbound, and Mounjaro. So right now there are 4 that really are useful in this space, and they're injectables, and you use them once a week, and you usually start a patient at a very low dose and you titrate them up to a max dose over the course of a few months, depending on how they tolerate the side effects, which can be pretty significant. I mean, people can complain of mild reflux, and then they can be more severe, like nausea, vomiting, complete loss of appetite, and abdominal issues. So in any case, the medications have been, like I said, very useful for our patients, and I think for the population of people that are struggling with abnormal weight gain and obesity. Unfortunately, as far as how many people can get their hands on those drugs, there's some limitations because they're very expensive. Insurance companies have carved them out of a lot of plans. We have certain situations where we start patients on the drugs, but then they change insurance, or the insurance changes their policies, and suddenly they can't get the drugs for a given diagnosis. And that can be very disheartening because sometimes people haven't made enough lifestyle and nutritional changes while they're on the medications, and then they stop the medications and their weight comes right back on. So I think in the upcoming year, we're going to see more challenges with regards to people needing the medications and being able to get their hands on the medications based on affordability and insurance, which is unfortunate, but that is the way it goes. The other thing I will say, we get a lot of patients coming in wanting to start the medications right out of the gate, and then they learn that they can't get their hands on them because of the insurance problems. And not all is lost there, because along with the medications that have come on the market and this sort of almost household term now, GLP, we have the opportunity to really educate people. And I think that it's important that people understand that GLP is actually a hormone that we all secrete. So you make your GLP just like you make insulin, or you make testosterone, you make estrogen. So Ozempic and Wegovy and these drugs are just hormones, GLP and GIP, that you can make anyways. And that these hormones are actually produced, Chris, in your gut. So there are cells that are in your gut, in your intestines, that if given the right kind of food or the right kind of supplements, you can actually increase your own production of the medication that you can't afford. And so our practice, we will use things like probiotics that make butyrate, and butyrate will increase your GLP. Specifically, we use a probiotic called Akkermansia, and Akkermansia will increase GLP production, which is pretty cool. And we also will use sugar, and it sounds crazy to use a sugar, but we will use a specific type of a natural sugar. Again, very few people recognize this as a health benefit, but there's a sugar called allulose, which is a really interesting and unique development when it comes to sweeteners, because allulose is a natural sweetener. It's a sugar, and it feels like sugar, and it tastes almost as sweet as sugar, but it doesn't have the same effects as sugar. So it won't increase blood sugar, and it also won't increase insulin. In fact, it actually decreases insulin, and it decreases glucose. And we know that allulose is a trigger for increasing GLP. So that's a win. So now we have two tricks that we can use if you can't get the drugs. You can use the allulose, and you can take that several times during the day. And you can also use the probiotic, Akkermansia. And then there are certain foods that result in increasing GLP productivity and production. And sometimes using those foods can cause a better control of appetite, because that's really what you're getting when you use Ozempic, Wegovy, Mounjaro, and these kind of things, is you're giving somebody some appetite control. That's really the biggest way these drugs work, I think, is by reducing one's desire to eat. They do have an effect as far as increasing your basal metabolic rate a bit, but you also can get that by triggering your own GLP. So I don't know. I think that where we've gotten to with regards to being such a drug-loving sort of, state or nation, we should say, right? There's a drug for everything. This is another part of healthcare, I think, where there is a drug for this. I like the drugs. I think they're great, but I think you have to use them with some guidance from a professional that can give you the medications and then decide how to titrate them, decide whether or not the medication is going to be long-term, like forever, or if it's a medication that's going to give you some momentum and then you can kind of back off of it. But I guess my fear is going into, this year, that people aren't recognizing that weight loss has been going on for an awfully long time without these medications. These medications have given us an extra edge and angle on treatment, but they've also given us an ability to educate people with regards how they can also take another approach to dieting or nutritional changes to increase their own GLP production, which I think is pretty neat.
Excellent. It's great to hear that although these drugs show promise, as you noted, it does come with an expense for underserviced populations, and the concept of actually having sugar that actually decreases insulin or decreases, anything negative around sugar is really quite good to hear. Let's go to trend number 3, which is always an interesting thing as you see the technology around advances in digital health technology specifically. As you're now monitoring metabolic markers, providing personal insights, now based on data, particularly data coming directly from patients, do you see any advances in that as we move into the new year? Is there anything in particular that you're excited about around digital tracking or digital health technologies?
Yeah, I think there's a lot of interesting ways in which clinicians and patients can use data these days to help with accountability and also help with regards to where their North Star is and where they got to get to. So a couple digital pieces that we like to use right now is one is a continuous glucose monitor. That's a device that is a little disc, and it would stick on the back of your arm and stay there for about 14 days. People will use that, and that little disc will sample your blood sugar and let you know with regards to if you eat a particular food, what happens to your blood sugar. Will it go up? Does it stay stable? Does it go down? So these devices, they're called continuous glucose monitors. We use a Freestyle Libre in our office. There's also one that's called the Dexcom. The information goes right into your cell phone, and then we can have that information actually come into our computer systems so we can actually see what's going on as well. And it's always kind of surprising to see blood sugars going up after people eat a healthy meal of a healthy breakfast of oatmeal or grape nuts or something like that, and their blood sugar goes well into the 150, 160s, and they recognize that maybe that oatmeal is not as good for them as they would think. So continuous glucose monitors, we think those are great. There are devices, obviously, that you can use that will track your steps, and people are obviously doing a very good job with counting steps and having loops closed on their watch or looking at their data and having contests with regards to how many steps they're getting in and any kind of movement a person does. It's great medicine. They should always think in terms of how you could be more active, because that really is a great lifestyle medication that people can use. And then probably the third device that I'm really excited about that is starting to get some traction is ketone monitoring, as people are becoming more interested in ketone diets and ketogenic diets and that sort of thing, and trying to look for how they can monitor whether or not whatever they're doing, eating, exercising, how that's affecting their own production of ketones. We are currently using something called Keto Air, which is a relatively new device on the market. It doesn't require blood testing, and it's not a urine dip. It's actually, you blow into this device, and the device will test the acetone in your breath. Acetone is a byproduct of a broken down ketone that you'd be using for energy. So this device will tell you how much acetone you're expiring, and that will give you some information as to whether or not your diet is supportive of producing ketones. So Keto Air is also a very cool way of looking at biomarkers and helping give people guidance with regards to how they should be approaching food and what might take them out of ketosis and what might put them deeper into ketosis. So to summarize, I guess, Chris, because I just went through a mouthful, the devices that are tracking steps, those are always very helpful. I think devices that are tracking glucose, continuous glucose monitor specifically, are a great way to educate yourself and your physician as to how you're responding to certain foods you're eating. And then ketone monitors, I think, are also going to be something this year that we will be talking a lot more about.
And you're really feeling that people, you're seeing, Dr. Cavo, that people are using those devices and they're coming back to meet with your nutritionist in between visits with some data, and that's really been enabled behavior modification, really sort of sticky, if you will.
Yeah, it definitely, we see people coming back with that information. And the other thing that is sort of also gaining traction in medicine right now is something that's called remote patient monitoring. And so RPM, remote patient monitoring, is another piece of technology that we're using in the practice, where we can give people devices like Keto Air, or we can give people a blood pressure cuff or a certain scale. And as long as that person is using it over the course of the month, the information from that device will come right into our electronic medical record. And we can communicate with patients throughout the month. We can communicate with them every single day with regards to what we're seeing on the devices they're using, and then make adjustments based on the data that's coming into our office. So remote patient monitoring is also a very nice technology that practitioners are now using in order to help patients with accountability, compliance. They can act as coaches and cheerleaders as well as physicians based on what kind of information is coming back from these devices. So remote patient monitoring and things like a scale or a blood pressure cuff, a glucometer, the Keto Air, these things are all also very helpful, especially with everybody running around and not having a whole lot of time. You can avoid coming into a doctor's office and sitting there waiting for 30 minutes to be seen for 8 minutes. You can kind of have your appointments throughout the month based in a virtual space or just through text messaging back and forth on the information coming in.
Sounds like a great use of technology.
Yeah.
Let's go to trend number 4. As much as Ozempic and certain technologies have been in the news, artificial intelligence, clearly this past year, the advent of AI, it seems like it went from, it's pervasive, right? It touches every aspect of our life, or it will. We're all trying to get our arms around, trying to understand the impact of it. But it seems, and I guess as we look at trend number 4, leveraging artificial intelligence and things like meal planning, or things like trying to enable, empower, not just, frankly, the patients, but also the nutritionists and people in your team. How have you seen, I know it's early for this, but what are the early indications of using artificial intelligence to better manage metabolic health, both on the practitioner side as well as the patient side?
Yeah, so I like the medicines. I think sometimes people are surprised to hear me say I like them. Artificial intelligence, I like that a lot too. I think it has tons of utility when it comes to both how we can function as providers and improve our ability to care for people. And I think it also helps patients out with regards to coming up with solutions for their medical problems and learn about what their medical conditions or metabolic conditions are and how they can be managed. Just to give you an example about how I've used artificial intelligence, I can give you a lot of examples, but one that sticks out in my mind, it just happened yesterday. We had a 15-year-old who has autism come into the office, who we've been seeing for a while. And currently, that patient has been having some challenges with regards to becoming bored after using their computer for a while, and then walks around their house and ends up in the kitchen, and in the kitchen ends up mindlessly eating an awful lot of food. And, the parents of this child, the family has been very supportive. The child wants to be successful. And yet there's this behavior that's going on that everybody knows is not optimizing his desire to control his health and his weight better. So this is actually called a behavior loop, where there's a trigger and then a behavior and a reward. And trying to change the pattern or the habit that this individual is running in, we had an awful lot of dialogue. The family and the child and I, we spoke for 30 minutes trying to come up with a way to change the behavior that we were seeing. He gets bored, he starts to walk around, goes to the kitchen, eats, and then he's going to repeat the process again because there's a reward system that's going on there. I came up with as many different ideas as I possibly could to disrupt this loop. They had tried all of them. So I opened up artificial intelligence as an idea that maybe AI would be able to come up with a better idea. So we plugged in the information with regards to what the challenges were. We plugged in what the behavioral loop looked like. We plugged in what already we know doesn't work. And we asked AI to go ahead and come up with some ideas with regards to what might work. And Chris, AI came up with a list of ideas, 3 of which the patient and the family were very excited about to try. And, I don't think we ever would have thought about, having one of the things was magic and developing magic tricks to kind of have a new talent, and how that might be something of interest instead of going down to the kitchen. Another one was getting into planting seeds and doing some garden. I mean, there are just like things that you wouldn't consider, and AI does that. So I think that that's a very positive space for people to start to play around in if you know how to use it and then finesse what it is that you're looking for. The other thing that we're using artificial intelligence for, and I'm excited about it, is for, like you said, dietary changes and giving some guidance. We've been fortunate to be working with a company called More Food, and More Food is an AI company that has millions of recipes at their fingertips in AI. You can put in basically what your medical and metabolic conditions are, your age, what kind of foods you like and what you dislike, and how many meals you can have a day or calories you can have a day. And boom, just like that, you can have a whole week of meals told to you by AI as to what would be good for you to have. So I think that going forward, using AI, if you're a patient or a provider, is going to be something that will be very advantageous as long as you just know how to use it.
It's really applaud your embracement of new technologies, and just like anything else, it could be used for good or ill. But it sounds like it's a good path forward to leveraging AI, and look forward to further developments on that. Last but not least, on the last trend that we'll talk about today, it's something I think it's close to both our hearts, which is, how do we, given the work that you and your team do, but physicians and medical professionals throughout the world, really, there's so much focused on healthcare and patient-centric care. The question is, how can that scale, right? How can we get beyond enabling more than just the doctor-patient one-on-one meeting, to see a one-to-many relationship, to start with the education around the various tools that we discussed, whether it's AI or digital health technologies, all the innovations associated with GLP-1, personalized nutrition. I know one of your missions at Pound Insurance Nation, and certainly one of the missions between our relationship with your organization with CDXR, is to figure out how we can use technology, be it web-based education like we're doing here with the Wellness Journey interview, some of the webinars that we've been doing together, starting diagnostically related support groups, so that we can really enable sticky, if you will, or really consistent patient engagement, and not even just with doctor-patient engagement, but also patient-to-patient engagement. We know the power of when patients have a specific diagnosis, how it's really beneficial for them to learn, but also ultimately to be part of a group of similar people in similar conditions. And I know we have just come and working with your team with the holiday challenge, and how that sort of get people to the holiday around various education and engagement techniques. Can you talk a little bit about the impact of things like social media, things like ways of getting patients engaging in between the visits, and where that's looking to evolve in the coming year?
Yeah. So I think social media is a real rabbit's hole if you're not careful, and where you're going to end up, because there are plenty of social media channels that are out there that have good content and great information. And some of it could be a little bit more misleading, I think, not on purpose for the most part, but still can be misleading. So I think you have to go into what you're looking for with a little bit of background as to whether, what kind of group has some merit. And I think that certainly having community support from groups, so people that are like-minded with regards to where they are and where they want to get to, they seem to have higher levels of success when they're working together as a tribe. I think that, you said scalable, and I think that's a real important thing to consider with regards to where social media could take you into a very scalable way in my kind of clinical practice, which is metabolic medicine. We rely on an awful lot of education to go out to our patients in order for them to make good decisions based on their nutritional choices, lifestyle choices, supplements, and medications. And in the clinic, in the office, we can only do it one patient at a time. But a platform like what you've gone and developed with CindyXR could allow us to have the ability to do webinars that are much more interactive and engaging with people that might be suffering from insulin resistance. And rather than to tell one person at a time, how complicated that diagnosis is and what it means, because so many people don't understand it, you could actually, put together webinars or courses or go actually into virtual reality to have these kind of discussions. And I think people get an awful lot out of that kind of thing. And then around those webinars and discussions, forming communities, whether it's on Facebook or Instagram or wherever it is that you want to have your communities of people with similar metabolic conditions, interested in accountability, and I guess your term is stickiness, so that when they do fall off the wagon, or when they do make a choice that might not be supportive of the management strategies around their lifestyle or nutritional changes, they have a group of people that act as cheerleaders or a support group that get them back on the right path and continue that momentum that they need to have in order to correct their metabolic problems. So I think that social media is, I think it's a wonderful tool. Again, if it's used correctly and you're getting the right information from it.
Excellent. Well, I'll tell you, we appreciate CNXR, speaking for the CNXR team. We appreciate you, Michelle, and the team at Pound Transformation. It's it's exciting. Healthcare is a $9 trillion industry, but there's a lot of work to be done to really ensure that the patient-centric care takes its place, that it's at the forefront. And I want to thank you for joining me and joining us on our wellness journey today. Thank you, Dr. Cavo.
Hey, Chris, thanks a lot for having me.